wondering what kind of health insurance we use or how we deal with medical issues or yearly physicals, blah, blah, blah. But the reason I'm doing this video, or we're doing this video, is because we're currently in Florida and I need routine blood work done. And so how do you do that when we're in another state? So
yeah, and it's not necessarily just when we're here. It's like we're never back in our home in network area. And we have an individual health insurance that has an $8,500 deductible. So it doesn't matter if you're in network.
So we have a normal HMO.
It's not an HMO. It's an individual plan.
Well, I guess I'm saying it's an HMO because if we're back in Wisconsin, Dean Medical is part of an HMO group.
Right, but we have like it's in network. It might be a PPO, or I don't know what they call it anymore. But
yeah, well, the reason I'm bringing this up is we have insurance, but what I've found, even having insurance, prices can be more expensive if you put it through insurance and then you still have to pay out of pocket. So I found when I needed my thyroid tested and just had it go through insurance, it was triple the amount versus me just paying out of pocket and finding a lab that could do the blood work.
Yeah, and it's not always that case though.
No.
Because sometimes what'll happen is the insurance company will be able to get discounts off of the price. But we don't want the insurance company dealing with it. We want to make the phone call. And I'm sure it's interesting because when you have an HMO or you have full coverage through your employer, whatever, you don't make phone calls to see how much is it going to cost me.
Yeah.
So when we call, they're probably like, what are you talking about?
Right.
There should be price lists. There should be information on the web on all these prices that hospitals, doctors, labs, everything charge, but there's not. And there maybe some do, but it's not common.
So example is the blood work that I needed done is a standard thyroid blood test. Did it back home, did it through our insurance, and we got a bill for $150, even though we have insurance. So then I go to LabCorp, start calling around, see what they charge for the same thing, and it's $48.
Yeah.
You gotta shop around, you gotta do your homework. And I need to take thyroid medication. Same thing, the medicine that I purchased when going through insurance cost me triple the amount, actually more than that, for my thyroid medication. So I shopped around, I called Walmart to see what their prices were, and their prices are $4 compared to $30.
Yeah, and that was when we had an HMO through the employer, because we don't have drug coverage now. So that was, even with the HMO, we found out that with our copay, we could actually be less, and so we started just buying it on our own. So that was when we had a full University of Wisconsin employee healthcare policy.
Yeah, I feel like sometimes it's a ripoff. You just gotta do your homework. And I think, and one other thing that we actually did too is when I was shopping around for the prices of medication for the thyroid, I take two of them. We ended up joining Sam's Club, which yes is an annual fee, but the price for that medication is ridiculous. It's $120 for just 1 month prescription. When you join Sam's Club, you get a 3 months prescription for $30.
Or $75.
$75, sorry. So that is significantly less, even being a Sam's Club member. We don't use Sam's Club for anything else, but it's, again, we're saving a ton of money by doing our homework.
Yeah, you really have to be your own advocate on that, of course. You can't deal with your health provider. Now, if you have full coverage and they're paying everything, no, just go with it, But if they're not, check prices, call around, be creative, because you do not have to pay the high prices that are out there. And there's more you can do too. It's like with LabCorp, I bet you could call and ask for like a discount too on top of what they already lower, would be my guess.
Yeah.
Because I worked in health insurance company for a while, and we did what was called repricing, and that was you get a claim in, I worked at IT, but the claims people would then call the hospital and work out a deal. So basically repricing that claim. So
I mean, it's annoying. You pay a premium for your insurance, yet if you don't shop around, you still end up paying more than what you really need to or should. If you even have something done at the hospital, people don't realize this, and I worked at the hospital. You can call patient care services and get a discounted price. You don't have to pay the bill that they offered to you.
yeah.
So that's really important.
Yeah, and I think one example is you went in for a physical, told them it's covered, so physicals are covered 100%. Said, I just want a physical because you needed it for your thyroid or something like that.
Yeah, so I could get my med.
Yeah, so just the med, there's nothing wrong. Well, you talked about something, just made mention of something. The doctor then coded it, so we got charged. In normal case, the insurance company sees that and says, yep, we're good, it's fine, pay it. Well, no, we're like, no, we did not talk about that enough.
We talked about my thyroid, which she asked me if I needed to get a new prescription filled, and I said yes. So she coded a thyroid on top of my physical, so then I got charged for that.
So in normal situations, then the insurance company would get it and just pay it. And again, no big deal, but then we saw it. We then,
disputed it.
Yeah, disputed the charge.
Twice.
And they came back and sent us a letter and said, no, sorry, we're going to charge you anyway. And then, like, a few weeks later, they refunded the money. So I don't know why they sent a letter saying, nope, you're screwed. And then we got the money anyway. But it's just watch, because the insurance, the healthcare field, more the healthcare field, is not set up to deal with individual non-insurance paying customers. So
Correct.
you have to watch what you're doing. So we've saved a ton of money by having a high deductible insurance policy, because we don't have many expenses. So we've been on it for 6 years now. And we pay, I think, between both of us, like $800 a month, maybe $900, somewhere in that range. Compared to, I don't know the number for like the high range one, but let's say it's $2,000 or even more, for that policy. So we're saving $12,000 a year. So we saved $72,000. Rough numbers, I don't know exact numbers, but something like that over that period of time. So that pays for a lot of deductibles. And we were young, and hopefully we still are. We don't have issues now. I'm sorry, I'm talking too much, but really quick, let me just do one more thing.
Really quick.
One more thing is, this only applies to us. Other people are maybe not as healthy, or maybe have other issues that they're dealing with. So. And
one point you brought up today when we were driving is, you buy whatever policy allows you to sleep at night. Yeah. Bottom line, if it stresses you out, do what makes you sleep at night in regards to health insurance, car insurance, travel insurance.
Right, everything. Yeah, travel insurance is a good example, all that.
But a great discussion to have as we're traveling around, and I needed blood work, and I'm not flying back to Wisconsin for it. So this is what, our lifestyle is, and this is how it works for us.
Yeah, unless you have issues. Some people do that are, not age-related, just health issues, and not even like they can live with it, all that. Then they need doctors and places and stuff like that. And that's all okay. Great. And you can set that up too. We can fly in and do stuff. But if you are just normal, you don't really have any chronic stuff or whatever, then go ahead and just don't stress on it. Yeah. It's pretty easy. I mean, we have the money set aside for the deductible, blah, blah, blah. Just don't stress on it. It's not that big a deal. And then it's freedom. We can go wherever we want to get our teeth cleaned. We can go wherever we want to get lab work done. If we need to go see a doctor in another country or even in the United States, it's like, it's not in network. It doesn't matter. Yeah. We have such a huge deductible that it's only if we had something major.
I think he's gotten too comfortable on the camera. He just is talking like he's talking to somebody sitting right there.
Yeah.
All right, time to wrap it up. I am dying in the car here. We need to move on and get some airflow. So thanks for watching, guys. If you have any questions on insurance, maybe we can help you out. Don't know.
I mean, we are not experts.
No.
So it's not, we can't help you on insurance. It's more, take it that it's not that hard. It's fairly simple to do. So normally I would say we can help you, but we don't. I mean, because everybody's situation is a little different.
I guess, and here we are arguing on camera. I guess
Not
my
argue,
point
just-
is people have asked us questions about that, and I'm telling you this is what we do. And so if you have a generic question,
Of how we do it or
possibly
something, yeah.
we can help you answer that on how we do it.
All right, there. That's better.
We do love each other. All right, we'll see you soon. See you on the next video. Thanks for watching, guys. Don't forget to give us a thumbs up and definitely leave your comments below. Have a great day.